Without further ado, I'll introduce Yasir Bashir. He is one of our consultants in the AI and advanced analytics space, and he's going to talk a little bit about what he's been working on. Thanks.
Thank you everyone for coming. So just to give you a little bit of intro, Dallas AI Meetup group that is run by Barbara Bhatti and Amir right there. They've been running it for 15 months, I think. I spoke to them. They just explained what we've been doing in the AI field. They asked me to present and go through some of the topics. So if you want to contact them, these are the email addresses of Amir and Barbara. So just to give you a little bit of quick intro to Saxony. Basically, Saxony, our approach to like Daniel said, for our clients to do more with your data. We help different customers and businesses with digital consulting, managed services, and management consulting. These are some of the topics that I'll be covering too, but on the healthcare side, these are the areas that we focus and provide services. Our agenda for today is we're going to go through AI strategy, then we'll look at the success factors. I already mentioned in the invitation. We'll go through some of the use cases, and then I'll talk about the implementation of AI project that we have just completed, and then we'll do a Q&A. Just a little bit of background about myself. I'm a senior architect at Saxony, focusing on healthcare data science projects. Before that, I was at Confer Health Solutions as a manager of solutions development, and before Penson Financial Services, building trading platforms on stocks, options, and complex options. So I'll start the presentation by looking at what the current status of AI in healthcare in comparison to other industries, other sectors in the country. So you can see the leading sectors, they're financial services, high tech, communication. To show that the horizontal is the number of firms that use AI or they're using AI, the percentage of those firms, and vertical is how much percentage in change or spending they're planning to do in the next 3 years. So healthcare is in the middle. There were about 17% of firms in healthcare. They are using AI, and then there's a projected to increase by about 7% of spending. So the healthcare is not too far behind, but it's not the leading sector in AI. So can you show of hands how many people are technology leaders and they're trying to explore AI in their companies? Great. And how many are physicians and doctors? And how many are technology candidates who want to learn AI and they want to use AI in their businesses? Great. So there's a good mix of technology leaders, and there's a good mix of the actual candidates of people who want to use the AI. So I didn't include this topic in the initial invitation, but I thought it's such an important topic that the more AI implementations we are doing, they are currently being implemented in a silo. So there's so many projects companies are working on. They need to have a good AI strategy to think about from a broader perspective of how they want to use AI in their business. So they currently, what I've seen in just my personal experience is that they see one problem, a business problem, and they want to tackle that. They build AI models, then they want to use those in their businesses. But the more AI is being used, the companies are going towards a more strategic implementation. The same cycle happened when the data got popular, and then digitalization, for example, in the mobile field, they start using it as a hype applications, but then they end up realizing that they need a more formal strategy. So I actually wanted to go through 3 phases of AI strategy for healthcare. So this could be applied to any industry, not just for the healthcare. So the first thing you would ask, or a business leader would ask, why we want to use AI, right? So AI is not just because of the hype, because of the people are talking about it, it's a cool technology. They want to have a reason why they want to use AI. So the first step in the strategy is trying to find out why we want to use AI. So I want to go step by step deeper in the strategy. So the first goal is to find out from a business perspective, is this something that they are losing market share, for example, or they want to add more customers, or they want to do something else, they want to improve their services or products, why they want to use it. So that's a question that they have to ask the first step in the process. So they can select the top 3 corporate areas they want to employ. So those are areas, not even products or services. They're just talking about these are the areas that we want to improve. So they may be profitable in some areas, but they are losing customers, they are losing money in some areas, and AI might be the good candidate to help them in that area. So the second step is where. So in those areas, we are not talking about products yet and services. They want to build competitive advantage, for example. They want to build how they want to improve it, or their products or services, build something different or improves their products so it becomes a competitive advantage in comparison to their competition. It could be, it's also possible that they have great products, they are selling it, but the industry is shifting towards something different. So they can forecast, for example, because of the introduction of AI, their industry is changing the way they operate, and they have to keep up with the pace of other competition, and they have to make those changes. So this is the second question is where. They can also adopt approach of build something, or you buy a company that is doing what you're looking for, or you want to partner with somebody else that is in the partnership. You get the technology, you get the tools that you need, and save you time and build to go to the market with those tools faster. So third is what. So that's where we are going deeper from high-level business strategy which includes areas, to the reason, competitiveness and other reasons. To the third one is what products and services do you want to build AI in. So now we're talking about products. If it's existing products or processes, or you want to build something new that is going to give you that advantage that you're looking for. So, and then also within that area, you have so many products and services that you want to prioritize. So it's not like you want to focus on all 3 or 4 different products at the same time or services. You have to prioritize between that area. So we are now up to the list of top products and services that you want to focus and you want to build the AI in. The fourth one is when and how much. So just to give you an example is, for example, in clinics, the staff has to go through work list of different patients, for example, during the day, right? So we will talk about for example, patients that are at risk. So you run the model, you get the list of all those patients, and that gives you an actionable object that you want to go in and take care of those patients. But that information within your existing business process doesn't get in the right place. It means that you have the AI, it has the information to build it now, but it goes into the EMR or goes into a business process where it takes 2 days for somebody to look at it and somebody to take an action. And that's not useful. You have to define within my processes where is the AI most valuable and how we can get that action taken as soon as possible on that AI output that we have built. So that's where, so you have to build that strategy, you have to define all these questions in order to build a good AI strategy. So this is part of the vision and planning. So you just have to think about those products, you have to think about your business. The next phase is capabilities, culture, and organization. So in order to build that AI, you have to, it's going to require changes in your organization, right? So how you want to build it, how you want to do it. So organizational structure and governance. So for example, you didn't have a chief data officer before. Now because of the focus on AI and AI runs on data, obviously. So you need to have a more focus on data collection and a data strategy on top of data. So you have to make some changes in the organization in order to achieve your goals. If any of these steps, there's a risk. If you misjudge or misdefine any of these steps, the full cycle is not going to produce the result or the goals that you're looking for. So you have to be careful. You have to spend more time on it because your whole strategy is dependent on it. And once you get into the execution phase, it's so hard to go back and change all of your define. So for example, if you defined it in that your clinicians need AI to define patients at risk. But afterwards, after a few months, you find out that's not the focus that you want to go and you want to focus on something else, then you have to stop everything, start over. So it's important for everyone to know exactly how to do it. The organization is important too, because if you define a great planning and vision, how do you want to execute? You need the organization to focus on AI in order to be successful. Talent and workforce and culture. So culture is also important because the culture is, if you go into traditional culture of you have teams, software development teams, you have database teams, they are working independently, they're not collaborating, then that culture is not going to be able to be successful in this strategy. So you have to have the traditional technology groups are now gradually are merging. So the lines between software development and database management are blurring. So that AI needs a different type of implementation, different type of structure to be successful. The next is set up and run. So you have the organization, you have a CDO, you have everything, but now execution is important too, right? So how do you implement the new operating model, right? So in your company, the whole model of executing it, who's reporting to who, and there's a high focus on collaboration and making sure that the organization is set up and operating model is set up to support the AI. You also have to obviously recruit and train talent. AI is the professionals who have experience in AI are in high demand, and the one way is to hire them, but other way is to train your existing technology talent with AI skills. So that's important too. And then agile. So the method you execute. So such an important thing is so AI strategy. There are a lot of components which already exist, like methodologies, agile, that are being used in this strategy as well. So the agile is so important is because you don't want to wait till 6 months before you find out that you're behind and your objectives were incorrect. You want to be able to see, especially in modeling, we'll talk about that in a few slides, is you want to have reputation outputs on a frequent basis, because you want to know how my model is being used, or what the accuracy is, what are the information it's generating, and you have to bring that information in front of your customers and users to get their feedback to improve the whole process. So that's your second phase. The third one is your roadmap and implementation. So you're now at the phase where you have the vision, you have the capabilities, and culture is already set up, but you need a roadmap in order to say, okay, this is great that we have done, but what is our roadmap within that one cycle? So this cycle right there is focusing on one product or services. So you can repeat the whole process probably about phase 2 and 3 on different products. You have already lined up your list of products that you want to focus on in phase 1. That's your vision. But on phase 3, what are my other products that you want to include in your roadmap that you are going to implement next? The third one is prototype and validation. So you have to define that, like I said before, you have to build prototypes and proof of concepts more on a faster level than before, because the whole models and the whole AI, you need actionable tasks. But how do you know if your actionable tasks are correct if you don't bring those tasks in front of the users who are going to be using it? So it's so important to have to build it. You bring your model in front of users, have them use it, then go back and reiterate. So you have to go through that cycle multiple times in order to get the perfection that you're looking for. So that's the AI strategy in the 3 phases. So the next is, this is great. So you have the phases and everything, but what are the factors that are going to impact your AI? So can anybody tell me what is the basic fundamental requirement for AI implementation? Data. Mm-hmm. So the first thing you need is data, right? So you, especially in healthcare, your data is in AI overall, but especially in healthcare, AI is so important, or the data is so important, but we're not producing enough data from a patient. Now, if you exclude the devices that we are now using for medical purposes, which are generating a lot of data, if you exclude them, you're only generating 100 megabytes per patient per year. That includes visits to the clinic, visits to the hospital, your EKGs, your imaging, all of that is only 100 megabytes. As compared to that, you generate 500 gigabytes for each flight of a 6-hour flight. So that's how much the data is different. Why they want to generate 500 gigabytes in flight? Because you have lives at risk, and you want to make sure that if there's any kind of issue in the flight, you want to collect that data and you analyze it, fix it, and be able to improve the hardware. So same goes with the healthcare, but we don't have that much data. So again, if you want to implement from a business perspective, is you want to go in and implement AI on all your business processes in healthcare, you need data. And there's multiple hurdles. So your different companies are not sharing your data. You own the data as a patient, but they don't release it in a lot of cases to share between other companies. So that's one problem. So the next one is processes. So I talked about where do you apply AI within the whole process. So I gave you an example of we produced a result from AI that you want to take an action on, but that output is not given to the clinicians or the staff till about 2-3 days later in the process. That's not going to work because that patient has left, or the condition of that patient is already deteriorated. So the timing and where do you put your AI is also dependent on your success factor. Is one of the factors is processes. It's like putting a V8 engine in a really old car where your engine is great, but the surrounding body of that engine or that car is not supporting that acceleration that you get from the AI. So next is change management. It's again one of the difficult topics where you have staff that have been with the company for 20 years. They're not compatible, they're not used to AI, not just in terms of, they don't have to know what AI is doing. They need to take action on the AI output. And again, if they're used to getting a file, a paperwork, and they read it and take 2 days to read it, then it takes 2 days to generate a report out of it, and now you're asking them to do the same thing in 2 hours. That's a change that you want to have. That's going to be difficult. So you have to train your staff you have to manage that change in your organization to be able to support AI. So a lot of people have talked to, they've said that we want to do AI and we want to focus on this and that. So there's a very narrow focus, but it's a whole, it affects everything. So, and requires, if you want to be successful, it affects your organization. So it's not easy, but your fruits of that hard work is going to pay off in huge amounts. So that's something that you need to take care of. The next is technology and architecture. Needless to say, you have to build your architecture and technology purely on the AI side to be able to scale. So if you build it for 100 patients, for example, and because of AI, the biggest benefit you get from AI is your speed, right? So how fast you get the output and how fast your business is moving. So that means that you used to process data from about 100 patients a week. Now you're doing 1,000. So is your technology architecture strong enough or scalable enough to support that kind of volume? So that's important. And again, there's if you want to be on the cloud, then you have to be, especially in healthcare, you have to be careful because a lot of regulations, a lot of laws prohibit patient data to go on the cloud. There's a lot of movement in that direction. Microsoft is working on getting a lot of certifications to allow big companies. Now they have a lot of certifications, but the mindset of those companies are still very, very kind of cautious, and they don't want to move their data, especially if you hear about a lot of breaches or data hackings, and then they don't want to bring, because in my previous company when I was working at Conifer, somebody asked the CEO of what is the number one thing that the CEO thinks about, and it's bothering him every day on his job. He said data breaches. So that's the number one concern, and it's not easy to move your data to the cloud. So next is execution method. We talked about it, agile, but it's so important to bring those results as soon as possible, so in front of users to get feedback from those users. That's the success factor too. Again, the timing and the speed that AI brings is critical, and you need to be able to support that. And your method of execution is important, that you need to be on a faster pace. Your team is one of the important success factors, because if you have everything and you don't have a team, you don't have talent, then you won't be successful. The team generally in AI projects consists of these players: subject matter expert. Again, we used to have business analysts who will go and talk to the customer or the business user and get the information and then bring it to technology. Now, because of the fast pace, you need a constant iteration of updates from customer, from the people, from business users. You can't just have that bad business analyst go and spend 2 months collecting that information, come back, and then it's not available. So you need to have a constant, that SME needs to be part of the team, so that they can then give you, so because see in the previous slide, the first phase is you're trying to resolve a business problem, right? And who understands the business problem? That's the person that you want to have in your team. Business strategy. Again, the business strategy, the strategist is a person who is representing the company's interest in the vision. So the SME is focused on one product and process. The business strategist is to convey, to make sure that what we are building is aligned with the business vision that we have defined. So then you have data scientists, ETL developers, programmers, and then if you're on the cloud, cloud architects. Every one of these roles are important, because if you don't have an even ETL developer, for example, who's going to bring the data for the model? ETL developer. Who's going to build the pipeline of data that the models could be retrained on a regular basis? ETL developer. So it's not, you don't have a level of kind of importance on any of these roles. Every role is important in the team. Then lastly, business problem. When we were going through defining the business vision, and the last thing which I specified was, what are we trying to achieve? What are we trying to build? So if you select a business problem, which is high complexity, low value, you're going to spend 6 months, 1 year, but overall your business is not benefiting as much as it should be. So the focus should be what can be done as fast as possible, and what has a high value. So that's something that should be, and should be aligned with overall business strategy. So that's the AI strategy. Any questions? We'll have a longer period of Q&A later, but just a quick, if you have a quick questions about this.
Just a quick check. Can everybody hear from that side? Good. Okay. Once in a while, you may want to.
Sure. Yeah. So next, we're going to look at the healthcare use cases. So the first one is the categories are clinical, which obviously identifies patient at risk and assist in diagnosis. Then we have different operational type of cases where process automation helps the front and the back end of the clinics. Then you have financial, where it helps with the claims, and then also in some cases also help in the pricing of the treatment for hospitals and physicians. The last category is your research and development. I'm not going to cover that in detail, but AI is also being used in the drug discovery and other use cases which are purely in labs. So the first use case is predicting patients most at risk. So this use case, if you have a surgery or an accident, for example, or the patient comes in the clinic and he wants to get treatment, and you have 10 different patients waiting in your clinic, you have to know who needs faster attention, who are most at risk, for example, who has infection that could worsen every 10 minutes, for example. And that information, when they input that information in the system, AI can then prioritize those patients and be able to tell them who to treat first, who to look at first. Again, the same thing is the real-time patient characteristics to predict patient at risk acquiring chronic conditions like heart failure. So if the patient goes into the clinic or hospital and says, I'm seeing these symptoms, now there could be hundreds of different, thousands of different combinations of illnesses which could affect patients, but how do you know what symptoms with appearance you don't think the patient is at risk, but the AI can help you define those patients. Now, AI can be trained on data where you have in your previous history you have identified these patients were critical, and with these symptoms, then you can use that information to identify those people at risk. NYU helped launch a predictive analytics unit in 2016, and they identify patients with cognitive health failures by evaluating their medical record upon admission. And then they get identify those patients, not just, and such an important thing, as I've talked about it before, was that not just to get the data or the output from AI. How do you want to use it? And especially in healthcare, people don't have time. So if they're using one application, they don't want to open another application and go through, look at the data, and say they don't have time. So they want to make sure that AI integrates seamlessly in their current processes, so that when they're looking at the EMR system, they see that indicator of who is at most at risk or critical condition in that system. They don't have time. So it's such an important thing. So again, the focus should not be just on creating models. The focus should be how do we integrate that data into your existing business applications so that people can use that on the spot. The other use case is predicting patient readmissions. So the patient with increased chance of returning to the hospital within 30 days. So there's a lot of operations, a lot of surgeries, a lot of treatments which are serious. When those surgeries and treatments are completed, hospitals send those patients home. Now, those, in most cases, the insurance companies going to question if that patient comes back in the same hospital within 30 days. They're going to say, why did you send the patient home when he wasn't completely feeling better? So, you know, a lot of times the hospital then wants to, they're in the business of, I mean, it is a business, so they want to make sure that they process as many patients as possible. But if you use AI, and based on the EMR data, it can predict if the patient is going to come back or not. So that's, if it is, then don't discharge the patient. Keep the patient in the hospital, take care of it, and then when he's ready to go home, then you can discharge that patient. A lot of times, the payers, which are insurance companies, they deny those charges if the patient comes back. So if you submitted initial claims to the hospital or to the payers, the insurance companies, and you then within the patient comes back and now you have to submit the same claims again, then the insurance is going to look at it and say, okay, there's something wrong, we're going to deny you. They're trying to save money, the insurance companies. So it's the most important thing is that we take care of those patients before we discharge them. Yes.
We'll pay for that.
We'll talk about that. Bad debt is a huge problem in healthcare, so we'll talk about that. UPMC discharge patients with technology. So now, UPMC is one of a large healthcare company. When they have multiple hospitals, when they discharge the patients and they know that they need to keep the patient in observation, nowadays they are discharging those patients with technology. How they do it is through, and if the patient has heart failure or diabetes, they transmit that data to different devices. So have you heard about the Internet of Things? Mm-hmm. Now you have Internet of Medical Things. Right? So there's so many companies right now which are, so the first picture you can see, you know, if you go to a physician's office, they're gonna put different sensors on your body and run through a few minutes of scanning, print a graph. That's your EKG. That machine right there, by just putting your fingers on that sensor, does the EKG for you. And so you can think about that data, and there's also a company called Verify Health. They have so many different options, devices that you can connect at home, and they transmit that data through your iPhone and through any other phone back to the physician system. So real time. So if that information triggers any alarm on the patient side, which is again, you may be using combination of multiple AI models. For example, the patient at home, they could be using these devices to then, when the data goes back to the clinics, they can do patient at risk model. So if you can run through patient at risk, it will tell them that the heart failure is coming in few hours based on the previous heart rates and other. So they can then, what kind of actions they can take? They can either call them and ask them to come in to the hospital, or they will ask the nurse to go and talk to the patient. So, and the whole purpose is is to provide a better patient care, right? And on the business side, you don't want those patients to come in for readmission within 30 days. So you're getting both benefits and be able to save money and be able to provide a better patient care. The readmission, just to give you what process is involved in training a model for readmission, and it's probably the same thing. You get the data from EHR. So the difference between EHR and EMR is that EHR is a broader system which stores a lot of your additional medical history. EMR is mostly at one location, like one hospital or one clinic. That's your EMR, one system. But EHR systems, they collect as much as they can the data from different sources, and then they combine it and they store that information. So this is the flow. When you train the model, you get that data, identify the admissions of interest. Now you don't want to just take any admissions. You want to make sure that what you are building your model is for is a certain type. So if you're concerned more about the heart failure admissions, your hospital is seeing a lot of readmissions on a heart failure, then you just want to include that data, not everything else. So what you would do is you will get those admission data with the background variables, so age, gender, there's a lot of other information. Then relevant ICD procedure and diagnosis codes, because what kind of treatment that patient did or received previously, and were they readmitted in the hospital within 30 days. So that you already know because they were admitted, right? So you have the historical data in your EHR system. You get that information, you try multiple models or multiple algorithms. Random forest is one, deep learning, you're going into, there's multiple different levels with different kind of functionality for each algorithm. We'll talk about that in a few minutes. And then you compare them and see which one will give you a higher accuracy, which one will produce a better result. And then you identify patients with highest risk. And then you send, so if you have the patient list of patients, every patient is going to be different, right? So these, at every 15 minutes or 10 minutes, you're running the test and you identified 15 different patients. Each patient is different, and each patient would need a different type of intervention. So you then basically take those actions and intervene based on either sending a nurse to the home or calling them or asking them to come in, or sending an ambulance to that home, to the patient, thinking that he's going to have a heart attack in 5 minutes. So that's also possible. So that results in reduction in readmissions and better patient outcome. Medical imaging, again, which we are still in the clinical type of use cases. So medical imaging is hugely important. I think within all different types of use cases, within the clinical, medical imaging is being used faster, and now has a lot of people are doing research on it, and is further in the process than other use cases. So there's an example about diabetic retinopathy is the fastest growing cause of relevant blindness globally, and if it's not detected in early stages, it causes irreversible blindness. So there are most models and algorithms, mostly in neural networks, especially convolutional neural networks, CNN, that can recognize the patterns within the images and be able to tell you if there are abnormalities and there's issues with the patient. And they can even detect cardiovascular diseases, but just by running neural networks on your eye image or retina image. So that's a huge development, because all you have to do is, you can think about the test, right? The patient has to go to the hospital, they have to run through EKG or CT scans, or there's other options too. But once you have those images, then you can find out a lot of different diseases, but just by looking at those images. And so this is they're traditional algorithms, and there are neural networks, which are newer and more complicated techniques. These kind of use cases mostly are used through neural networks. There is a company called IDX, which FDA just approved to run through the systems. And in the image, you can see the yellow line, which is showing moderate level of concern. And it has different levels. You basically provide an image, and it will run through and try to detect. Now, this process is still, you have to go through a review of a doctor or physician. It's not like it's just going to tell you if you have this disease or not, and then you're starting the treatment. No. But instead of spending about 2 hours looking at the image, and you can see how healthcare costs is being increased and how much the physicians are charging for their time, this basically reduces that time that the physicians are spending on reviewing your images and get you the results as soon as possible. So if somebody who's kind of on the edge of having a lot of problems or having a heart attack or something like that, or cardiovascular diseases, having this image reviewed and given results faster may save somebody's life. So those are hugely impacted use cases. So before we were talking about the clinical, now we are looking at the operational. Now, just give you high level, the clinical mostly deals with the diseases diagnosis. Operational is what happens in the physician's office or in the hospital. So how to run through that operation is to process as many patients as possible in an efficient way. And then we will have a financial, is that how to recover that cost from payers and other sources. So we are at the first use case for the operational propensity to pay. So we were talking about that is bad debt, which is uncompensated care, costs healthcare industry about 14% of net patient revenue. It's a huge problem. Of net. So it's a huge problem of which patient is going to pay for the care. By law, if you walk into an ER, you have to be provided a treatment. You have to be taken care of. Now, they have no choice. They can't just say, patient, we're not going to give you a treatment because you can't pay. They have to provide you a service by law. But they also have to take care of their business too, because the more losses they face, they have to recoup that money somewhere else, right? So the higher the healthcare cost is going to go. So this is one of the reasons why the healthcare cost is going up, is because there's also bad debt. There's options, and there are companies who are trying to reduce the bad debt, but this is one of the biggest issues in the healthcare industry. When you go to, like I said, when you walk in, staff has no insight, has no idea which patient are going to pay 100%, which patient are going to pay 50%, or which patient are not going to pay at all. So they have no idea. So AI can help in this area too. They can, when somebody, high risk patients in this context is the high risk means they're not going to pay anything, right? So if the patient is in the hospital or in the clinic, there are ways to apply for charity care. And there are companies, there are organizations who will pay for patients' care if they can't afford it. But the problem is you have to apply for those charities care. You have to sign some documentation. You have to be there in order to apply for those. So the AI can help in when the patient walks in and they insert their information in their system or register themselves. Companies have gotten information either from your credit score or from other companies to know exactly what's your background, what's your income, and there are a lot of other factors which that goes into predicting if you're going to pay the amount that you owe or not. If they have a high risk patient, they're going to ask you to sign additional paperwork so that they, in case if they can't recoup that money, then they can apply for charity. Here. So again, same thing, same kind of actionable task within the process. So they can, they have to look at it. But at the same time, if the patient leaves the hospital, they're gone, right? Now you have a list of patients that which have an outstanding balance, and they're not responding to your calls. They're not paying their balance to you. What are you going to do with that? So you have in Conifer, we had a division where we had about 100 people. They were calling patients, and we have about 10,000 patients, in the list, and you can't cover all of them in one day, right? So how are you going to handle that problem? So you can build AI models that will tell you, based on your history, based on your condition, based on your amount, based on a lot of other factors, these 100 patients have a higher chance of paying your amount. So don't call anybody else. You go through that list. And they are sorted in a way that you call the patients that have a higher probability of paying first. So your resources are working in an efficient way, and they are more optimized than just randomly calling any patients and leaving messages. So that's where the AI can help that problem. Type of interventions. So you talk to the patient. Now, what do you want to do? AI can actually tell you, the clinicians, what kind of intervention is going to work with these patients. So if based on the data, based on the history, if a patient is more inclined towards payment planning, so they can pay $2,000 upfront, but they can pay $100 every month. I can identify those patients. So when you call them, you're not going to start with saying, there's a $2,000 outstanding balance on you, can you pay? They're going to hang up. They're not going to talk to you, right? So, because you can't reach them through either a mail or through a phone call. So you have to know exactly what type of intervention is going to work best for which kind of patient. So AI can predict this. Payment plan, charity care, alternate insurance sources, those are different types of interventions. Now, if they don't pay, they can report to their credit bureaus. So if they do that, the patient is reported, it's on their credit history, the hospital is not going to get anything, right? So if you focus and use the AI models to then go through these interventions, you might not get the full amount paid off, but you'll get something, right? With that basically means you're recovering some funds, and the patient's history is not marked for not payment. So it's a benefit on both sides. So the next one is forecasting patient no-shows. That's another big problem in clinics and hospitals. If you're not showing up for your appointment with the doctor, what are you going to do? Right? So when the patient is calling you to make an appointment, you have no idea which patient is going to show up or not show up, right? So how do you handle that problem? The AI can build a model that will tell you, mark it as this patient is not going to show up even on these days. So when you're talking to the patient, you're going to say, yes, we have an appointment, but we would recommend coming on Fridays instead of Mondays, because the AI model is going to tell them then that patient, based on the history, tends to miss appointments earlier in the week. So it could be either week or the days, or could be the time slots. So So they, just to optimize, just to make sure that the patients get the appointment which they can come and taken care of. 10 to 30% is no-shows in the nation. It's a huge, yes, it's a huge gap. And then it causes underutilization. Obviously, the doctor's waiting for a patient. The doctor thought that the patient's going to show up. They're not looking at the patient. They're not doing anything. You have staff and you have equipment. So if you have for example, EKG schedule and you don't show up, they didn't schedule another patient for EKG for that time slot. So it's underutilizing those equipment too. Reduction in clinical efficiency, obviously, the decrease in access to care. If you take up an appointment and you don't let other patients who need that time slot to come in and look at and see the doctor, you're taking that opportunity for those patients away from them. So that's another issue. So this health system in New England that built a no-show model, and they looked at the patient attributes, demographics, past no-shows, obviously, the day of the week, and if it's after or before or on the day of holiday. A lot of people tend to miss the appointments because of a holiday. So if it's the next day of New Year, the chances are you're not going to show up because a lot of reasons. So, and then appointment times too. So if you take an appointment at 7 o'clock in the morning, and chances are you're going to miss it. Different people have different habits. Some people will wake up early in the morning, be able to see the doctor at 7 o'clock. But there will be people who will wake up at 9 o'clock. So the AI model looks at those trends and be able to identify the patients that are going to have problems coming in. And the last one was important too. How far back you took the appointment. So if you took the appointment 2 months ago, chances are you already forgot about the appointment. Even with the reminders, you may not even realize you had an appointment. So those if that's the case, then the AI can tell you, don't give this patient appointment for 2 weeks from now. It has to be within the next 3 days. So those kind of information AI model can generate. Now, AI model can also not just look at the patient, but can look at your practice. If they see in your regular practice how many patients they are missing a certain time slot, they can overbook it. Because the chances are, if you have one person coming and it's not going to show up, you're going to have a time slot open. So you may want to overbook it and then try to adjust if both of those show up. So those are kind of things that will help us.
My doctor uses no AI. I triple books every time. Wait 30 minutes.
Does he give you travel vouchers?
He actually finds people who don't show up. Takes their card and finds.
Yeah, they always say they're going to charge you, your insurance won't
Yes.
pay if you don't give them 24 hours advance. But if it's an emergency, how can you know in 24 hours that you're going to have, I'm not going to know in hour 26 that I'm having an emergency in hour 25, and then I get charged for something.
And a lot of people don't have any problem paying $25. They say,
if it's an emergency, you can help it, yeah.
Sure.
And then I ask them, well, how many times have you kept me waiting 3 or 4 hours?
Right.
Well, not that long, but.
When does the patient get compensated because we wait for the doctor?
Right.
Right,
No, exactly.
right,
Yeah,
right.
so you have a lot of times they give you 100% agree with you. That doesn't happen is because but that should happen.
If my dentist need a break, you also can take it.
Right. Yes, there's a lot of improvement on operational. They tend to take patient on, as granted, but they try to make sure their time doesn't go to waste. Even though that they bring the patient and they're waiting for 2 hours for the doctor to show up. Yes. So we are running kind of behind on time. So just to quickly go to the process automation, data entry. So when you go to the doctor's office and you're talking to the doctor, how many times you have seen the doctor is typing in the EMR system application your data, your information. You know, you're waiting and looking at the doctor and he's typing for 5 minutes. That data, that time is so critical, so important. He could have seen out, another patient. Automation in the AI through voice to text can be done, and it takes a minute to say something, then to type, and it might take 5 minutes to do it. Patient chart notes, prescription medication, lab orders, that all can be done through voice to text. Not just any voice to text, but they may use certain medical terms or codes which your system be able to recognize and find the application, open that screen, and enter that information. So it's not purely just a voice to text, it's a specialized medical voice to text. Denials. So just to make sure, there's a difference between charge denial and charge rejection. So rejection is the insurance company would say, you're not covered, and we're not going to cover the cost. We're going to reject the claim. The denial is they found an error in your claim. They are covering it, but there's no social security number, for example, or there's no date or codes in that, and they are missing. It's about $262 billion annually that are denied in the whole healthcare system. 50%, only 50% of account receivables this is I'm talking about between the hospitals, between the providers and the payers, which are insurance companies. Only 50% of account receivables are received within the first 30 days. 30% of claims are denied initially, and 18% are never collected.
This is nationwide?
Nationwide, US.
Only US?
So AI can help in 2 ways. Is to, when you call the hospital and say, I want to take an appointment, they want to make sure that the insurance company, they check the eligibility. Is this test covered in your insurance or not? The operational, the staff call the insurance company, stay online for about 15 minutes, they find out you're eligible for it. That something can be automated. The other is you're removing when you're filing your claims, you remove the errors, and that's faster and more secure. This is the last financial, the detecting the payer behavior patterns. This is for if insurance company is paying $100 for a treatment, and the hospital have a contract with them for $100. And if at any point they're either charging more or charging less, then that's something that they can find through the history and update their contract with that payer in the future. So that ends all the use cases. We're now looking at the implementation of the project. Saxony just completed. We're going into the phase 2 of that project. We're adding more states to the whole system. So this is the high level overview, and depending on the time, how much we want to cover. So just want to talk about the business process. So what's the business process? What are we doing here? So there are 2 different goals, what we are trying to achieve. The first one is what our customer is looking for is that if there's an accident and when you go to the ER and you start getting treatment, the hospital is going to file claims, right? And they want to know over time, if you go back multiple times to the hospital to see the physicians for follow-ups, how many of those claims are related to the accident and how many are not? Because that makes a huge difference as far as collection is concerned, how between the peers and the insurance. So in this example, day 0, you have emergency room visit. Then you have, it's a head injury in this example, but you can see in the middle, the orange ones are not related to your head injury. They need to know. And by just looking at the codes and by looking at the text, it's not, almost not possible without AI that you can recognize those. So that was one of the goals. And then also, how long should they keep the case open? So for example, if they close the case and you still have another claim that comes in that's related to the accident, that's going to be a problem because they're losing that money. So that was the goal. Claims related probability that they want to find out. The data that they have is case data, which is what happened or what date, what type of accident it is, and what's the status. Patient demographics, pre-existing condition. If you have a pre-existing condition of a heart condition, for example, and you got into an accident and you broke your leg, and you have a wound that they treat, if you have a heart condition or heart attack, that the chances are it's not going to be related to the accident because you already have a pre-existing condition. Then diagnosis and procedure codes that you have the data. And then other thing is, like I said, when to close that case. Now, I told you before, team is such an important thing. In our project too, we have client teams, which we have a technology leader, we have business owner and subject matter. And then from a Saxony, we had Charity Wilson, she's here, who worked really hard on initial data and on running the models, analyzing the data, what the trends are, what the data quality is. And then we had Eric Hilton, I don't know if he's here or not, but he built the ETL process. He's still working on the project to build Informatica pipeline. And again, like I said, each one of those team members are so important because if you don't have data, you can't build models. And if you don't know the weakness and the quality of the data by doing initial analysis, you're going to have problems later on. So, and then Alan is right here. He's project manager and director of the project.
That's the unimportant part.
I disagree.
Can you go to the previous slide, that last bullet point of the previous slide? Case closure.
Closure. When to close the case, when are all the related claims have been received. You don't want to leave that case open and hope that there will be other claims that are coming. That because if you leave the case open for a long period of time, you're wasting your resources who are keeping the case open. So you want to be able to. So this is even difficult than identifying if the case was related or not related, because you need to find the right time based on the history of your accident when most of those claims have been received. Means that most of those treatments have already been completed. Then you can go ahead and close. So I'm going to go really fast through this. There's a lot of information here. The first thing is business understanding. Everybody already know about it. Then we have data acquisition, understanding, realization. Charity worked on it a lot on this project. ETL, which is Eric. And then pre-model data processing. We have model algorithms. You have to select the model or algorithm which is right for the problem. If it's more complex problem and traditional algorithms are not going to work, then you have to decide what's going to work. Model feature engineering. If you have categorical data, you have to encode that data because most of the advanced algorithms only work on numbers, on integers. So you can't process text. So you have to transform that. Also define what features do you want. You don't want, if you have 100 features, you don't want all of them to be included in the model because some of them are not as important. Model training, obviously. Then you have validation. Once you have built a model, you run through the results, you get the output. Now you have to go back and validate to make sure your model against a full data set to make sure that your accuracy is sustained. If you do, most of the time when you're training the model, you do 70-30 or 80-20. So if the 80% of the data is used for the training, and you're only testing with 20. That's great, you get 80% accuracy. Now, what we did, and which we should do, if we had 10.5 million records for the evaluation case that we were playing with. And so we went back and validated the accuracy on all of them. We're treating it like not a training, but just through inference, just make sure that that accuracy is sustained. Not on 20%, but for 100% of the data. Model deployment, again, as we talked about before, model creation is important, but there's so many other tasks outside of model creation that are important. How do you make the data available for other applications to utilize? So the deployment, and in our case, we built the web API for other applications to utilize with security. It's an internal application, not an external facing application. And the customer acceptance. So when they start using the application, using their application, we have integrated our data, our outputs, our actionable tasks within their existing application. Then how is it affecting their process? And are they accepting those results or not? Model retraining. So especially in healthcare, the laws change every few months. Different states have different laws, right? So, and the trends of your accidents change all the time. So when you build a model, you're going to find out immediately that your accuracy is going to go down. It's possible. Then how do you keep it up? So you have to retrain your models on the new data. Feature announcements, and the same thing is that you are looking at adding new type of data, or new states, or new functionality, new features too. So we didn't have, for example, if you didn't have one of the major feature at the time of model creation, but now you do, you have to make enhancements in your model to cover that from this important feature. Sometimes the new feature improves the accuracy, sometimes it doesn't. But that's the process you have to go through and include it and see if it actually keeps up the prediction. Success factors. Again, the goal was to increase the process efficiency and improve customer experience. You're identifying those cases where they are related and not sending unrelated cases for your business process. That improves the efficiency of the process. Data acquisition, I'm just going to go through data pre-modeling, same thing, labeling, and a lot of people have already know about the data formatting cleanup. In our case, we took 3 years of data. How much data you need? Because if you see a major, either a replacement of data, means a replacement of system. If you have existing EMR system, and 3 years ago you replaced it with the existing one, but before that you had an old one, its data is completely different than your current one. You can't use that. You should not include that data in your system, because you're going to have two different types of data. Your model accuracy is not going to go up, and the model will try to accommodate the patterns within those two systems' data. So you have to find out if was there a major change in your data or the systems, and take it from there and from that point on. Then also ICD codes. So you have ICD code 9 and 10. How do you convert them? You can't keep them, both of them. You have to convert 9 to 10 or 10 to 9 in order to, and that's the business decision you have to make for this. Now, algorithms. I want to give you overview of, this is a list of traditional algorithms and the more complex newer algorithms. And as you can see, different industries, different sectors are using, how much frequently they're using of what kind of algorithm is it. You can see that people talk about, there's a huge hype for TensorFlow's neural networks, and there's a lot of other different recurrent neural networks. But still, my recommendation is start with the basic algorithms. You look at the regression, you look at the tree-based algorithms. Try to implement those, because you'll find out those are easier to train, and easy to implement, and they work better than neural networks. So there's a kind of a myth that the more complex algorithms you would use, the better accuracy you'll get. That's wrong. You should start always with a more simpler algorithm, go towards the higher. Now, you can see that those frequency is different between different industries. It's because of their nature of the industry, nature of how those industries work. And again, the nature of complexity and the patterns in those data. So that just gives you a high-level overview of different ones. Like I said, we had 10 million records on evaluation data. If we were classifying that data yes or no, if it's related or not related. In the actual data we had, blue is the actual data, yellow is our inference from the model that we built. So you can see that we had 10 trending towards no more. But when we talked to the business owner, he said that the difference between those two could be is the human factor. It's possible that some people have marked them wrong, and they are not related, but they marked it as related. So we are kind of improving that. That 18% could be higher if there weren't any human errors. Same with the model accuracy on cases level. If it's really not related, feature importance. Now, I can tell you, as a process of modeling, it has to make sense when you look at the features and say, from a business perspective, it doesn't make sense or not. So on the claims model, these are the most important features. So a lot of algorithms will give you in the modeling phase, tells you what features are important. Now, if you go to the hospital, what's more important, the treatment that you get or how old are you? Right? The treatment you get, right? That's the reason we have ICD-9 diagnosis code, NDC code, which are pharmaceutical, which are medicines, and then procedure code. So if there's any kind of procedure done on then you have age and number of days. So from a business perspective, it makes sense. When we talk, this is kind of validation. When I was talking about we need to have subject matter expert in the team, they can validate if the features that model is indicating those are important, make sense or not. On cases level, now cases is more related to number of days and how much money we have paid on a case level. So case consists of multiple claims, related claims, right? So if you had an accident and you broke your leg, it's not going to cost you $1 million, right? It might cost you $10,000, but shouldn't be more than that. So that's the reason you're related, not related. Related paid dollar is so important because the model's going to look at it, how much money we have paid for this accident already. I think from a timeline, how old the case is, how much money they have paid, this should be close. So that makes sense. Projectionization, again, we are running short of time. The model, we need to build an API, and then client app backend talks to the API and get the data. Now, we don't send a flag back. We is not saying it is related or not related. We're saying this is a probability, right? So that's the percentage. So they can then adjust on the UI side what's the definition of yes? If it's, sometimes they say, okay, reduce the probability and anything more than 40% is yes. But sometimes we want to be stricter with this kind of hospital. We want to increase it to 70%. Anything above 70%, yes. Everything below it says no. So inference, this is the structure that we were, the last slide. The most important thing, there's a lot of issues, a lot of people are talking about it, is that the business users and the business groups don't trust AI. Right? So it's kind of black box. The more complex algorithms you use, the more trust you lose from business owners and business users. How do they come out? So especially in healthcare and banking. And if you, for example, if you reject somebody's loan, by law you have to define why you're rejecting it. So you can't easily just say no. You have to give a reason, right? So same thing with AI in healthcare. If you are saying, this case is related or not related, you have to give some understanding of why it's not related. So there are still a lot of research going on which will go into the algorithms to find the log and the trail of how the algorithms work. But what we did, we gave them a feature level understanding. So these are the features. This is why we give. This is why it's related, not related. So this is the case. It's a 16-year-old female who had accident, who had an open wound. So 873443 is the ICD-9 code for diagnosis, which is open wound. Then you have leg injuries, and you have ankle and foot injuries, right? And then you also, because of the pain, you were given hydromorphine injection, right? So 4 mg. So if you take that, and the most important thing is also the number of days is day 0, means that the day of the accident, right? So again, you look at all of that data, and we came up with we send 2 values back. One is no and yes. On the right side is yes, which is 81.7%. We're confident that this case, this claim is related to the accident because it's open wound. And you also have hydromorphine. You just can't go to a doctor's office and say, I have an open wound. There's a reason why you got open. Right? It's happened. So it's related to the accident. So what we did, we gave them a feature level understanding of what features and what data points are pushing towards yes and what are pushing towards no. On the red, you can see that the age is kind of a little bit, but the highest level is you can see the ICD diagnosis code. The open wound is the highest factor in the algorithm that tells that this is related or not related. Then you have days. So anything like day 0, the day of the accident, it has to be. There's no way you'll have some other issues. You're focusing on your recovery and treatment at the hospital. So that's all those factors. See, I choose this example because in the data they didn't have any. They have injection, which is procedure. They didn't have any diagnosis, or they didn't have any medicines, prescription medicines. So in the blue, you can see NDCCD code, which is blue, which is if you had an accident, you should have been given some kind of medicine. So in this graph, you can see that the blue is trying to push towards no. Because we have a value of 1.5. Anything above 0 is yes, below is no. So, and you can also see the base value is negative 1.9. You know why? It's because most of our data is flagged no. Because you have in our data, there's a lot of no's, not related claims. So that gives you the base. So this kind of understanding will give the business users some understanding of why this claim is. They can't come back and say, this is not related. We are telling you that you had these procedures on the day of the accident. You can't say it's not related. So this gives us some kind of comfort level.
I have a question on that. Okay, that hydrocortisone or whatever it was, the morphine, that's really kind of like a controlled substance. So why didn't they flag that with the NDCD
So, because
code?
it's not, it was through a procedure.
Oh.
So through IV.
Okay.
So the IVs are not medicines.
Oh, it went through the IV. Okay,
IVs.
but if it went in a different
Through
a pill or
pill or
what if it
something?
went through an injection, like a needle?
Yes.
It would have been a,
Yes, but I think there were a lot of other stuff,
Oh,
a lot of
that's
other
weird.
procedure going on at that point. They had an open wound.
do you think that's an error then?
No, this is the way that the hospitals flag those ICD codes. It's
Okay.
possible that they could improve it and mark it as diagnosed as a medicine or prescription.
Yeah, well, I
but
would,
it's possible.
yeah, I would see that as a matter of a perception then.
Right.
And
So-
that's where you're gonna have a lot of
Sure.
errors, because doctors
Yeah.
are gonna perceive one
And-
thing as one way and
Correct.
another thing is a different way.
And a lot of these are based on how you do your business, how you treat how you flag it. So
Right.
it's that we are not saying what's wrong and what's right. We're telling them based on how you work,
Your history,
and
yeah.
your history. This is how we want to flag it.
Okay.
So they are not gonna have any problem with this because they've been doing it for some time.
Yeah,
So
but
this
if
is
they
just
go
regular
get a job
practice.
at a different hospital, they
Sure,
might.
and that will be a different model. and
Right,
that will be
right, right.
different
Okay,
data.
that's crazy. So everybody should have their own models.
Right.
Just kidding. That's a bad joke.
So just last two topics, and then we'll wrap up. Application containerization. Just a quick. I know there's a lot of we can talk about it. Is how do you deploy your application, right? You have a VM, and you have most of it's done in Python, and there's 30, 40 different types of libraries in Python. So you can't just maintain all of those versioning and make sure when you deploy from dev to test to production, you maintain that number of versioning and control them. So Docker or any kind of containerization resolve that problem. So this kind of VM kind of concept, but that includes your code, runtime, all the files, all the libraries you need. I'll put them into a container, build it, and not just send my code, but I'll send the container for the deployment. So all they have to do is not worry about the libraries and the versioning and everything. They just take the container, put it somewhere in the test environment, it's up and running. Do the same thing in production. So it reduces the time of how fast you can deploy, how many issues you're going to get with the deployment. The last topic is Kubernetes. I don't know how many people have heard about it, but those containers, if you want to manage them and how you want to deploy them, you want to manage hundreds of containers, then Kubernetes can help you do that. It's a managed system where you can monitor the performance, you monitor the space, you can schedule the deployments, or you can manually configure what kind of versioning you want to get to different containers. But if this is a large-scale deployment technology, open source framework that you can use.